Good morning and welcome to WGN TV Political Report. I'm Paul Lisnick. We begin this morning with the growing number of COVID-19 infections across the country and here at home. The CDC now recommending masks for everybody in some indoor settings, despite your vaccination status. The resurgence has left leaders at all levels of government in a predicament. For more than a year, politicians have promised a return to normal life if enough people just did their part to stop the spread. But with stagnant vaccination rates and the Delta variant accelerating case numbers, many are wondering, are we now headed backwards? This week, Mayor Lightfoot and Governor J.B. Pritzker tried to stay cautiously optimistic.
It's of great concern to me that we have a rise in cases, particularly the Delta variant, which tends to move much faster than previous variants. And so I am looking at all the possible mitigations that we should consider. At the moment, I want to be clear with everybody, wear your mask, but most importantly, get vaccinated.
We're not seeing a huge surge in hospitalizations. That's important. Or ICU beds, or people on ventilators. However, the people who are getting sick with the Delta variant, 97+% of them are unvaccinated, and they're getting very sick. So we need people to get vaccinated.
Yeah, the rush to convince the vaccine hesitancy is on. In Kentucky, even staunch Republican Senator Mitch McConnell is hoping to boost vaccination rates, dumping his unused campaign cash into an ad campaign, urging supporters to just get their shot. Well, Professor Eric Nisbet is the director of the Center for Communication and Public Policy at Northwestern University School of Communication, joining us this morning to talk about what's next and how all this got political. Professor, thanks for joining me.
Thank you very much for having me.
So, I almost want to take this back to the beginning, if I can, with you, which is, how did a global pandemic become political? I mean, it should be about health and lives, and somehow it has become about conservative, liberal, Republican, Democrat. This is your area. How did that happen?
Well, it's been political from the very beginning, and it's just a reflection of the polarization in our country. Many issues that shouldn't be necessarily quote-unquote political have been political for a long time, simply because our politicians and our electorate see it as a winner-take-all situation. And thus, when it's in that type of sort of combative context, compromise, moderation is not an option if you see that you need to win against the other side at all costs.
And of course, now we're seeing masks coming back, mandatory mask wearing is coming back. So that, of course, has become political. Now it's become a sign of freedom, or not freedom, when you have to wear one or not wear one. And look, there are some good reasons for people not to take a vaccine and medical reasons and whatever. But I'm just sort of curious, in the history of this, if you know, was there such a thing during measles or during polio? Was there ever such a thing, a fight over this kind of thing in vaccines and masks and such in the past?
Not going back that far. And of course, our country was less politically polarized then. And maybe if we had the same level of polarization and sort of social and political forces, it would have been more politicized. I do think, though, and there's research that shows that there was a great deal of polarization around the HPV vaccine, which was, 10, 12 years ago. And you did see sort of a red state, blue state divide in HPV vaccinations. Same thing to a degree with the swine flu. When that came out, there was a bit of polarization around. So historically, 40, 50 years ago, no. But in the last 10, 15 years, yes. Again, it's a reflection of these sort of deeper social, political, economic, cultural trends we're in.
And of course, we've always been able to look at the CDC as kind of the gold standard. We listen for what they have to say, and that gives us our marching orders. But now, of course, the CDC is changing its tune from time to time. Wear a mask, don't wear a mask. Vaccinated people have to wear a mask. Is there any way for the CDC, it seems to me that it's lost trust among the American people. How do they gain that back?
Well, unfortunately, it's much easier to lose trust than gain trust, right? So trust goes away pretty quickly, and it takes a long time to gain it back. I think the CDC made a mistake in lifting mask mandates for those who are vaccinated back in April. It was premature. At the time, they said that, well, by lifting mask mandates for those who are vaccinated, we're giving an incentive to others who are unvaccinated to go get vaccinated so they don't have to wear masks. But of course, that was a poor policy choice when you don't have any way to verify who's vaccinated or not. Vaccine passports have not been put in, or credentials, or other types of, or even vaccine mandates until recently. And I think it was a misunderstanding of both the politics and the psychology, where there is a huge correlation between those who were sort of anti-mask and anti-vaccine. You're talking about the same people. So I think they misread the trends. Delta has been coming for a long time. I think they misread the psychology and the politics. And I think that has now created a place where it's hard to go back. It'll be very hard to reinstitute widespread mask mandates or other social distancing now that they have sort of lifted them in the first place.
And of course, that's what you say reflects the CDC. Let's take a look at President Biden, the Biden administration. He himself has changed his tune, and as we see him challenged at the end of a press conference this week, basically saying, look, things have changed and people aren't getting vaccinated as they were supposed to. When the White House imposes stronger standards, they didn't really go terribly mandatory on things, but when they start toughening things up, what message does that send for leaders at the local level? I mean, certainly we'll talk about the state and the city here, but does it make things easier for them when the feds get tougher?
I think it provides some cover, sure. You can say that you're abiding by either federal or CDC standards and guidelines. That does give the local leaders, political leaders, state, local, the ability to then enact guidelines along those lines. At the same time, you're again going to see sort of, unfortunately, a red state, blue state divide. And even within the state, within Illinois, you might see between Republican and Democratic areas and localities a divide in how well they enforce certain types of guidelines or adhere to them.
So let's come to Chicago. We had, of course, Lollapalooza this weekend, wrapping up today. And, sort of curious, 100,000 people. You've seen pictures, I'm sure, on social media. Looks a bit frightening, but Dr. Arwady and Mayor Lightfoot, hey, there's great protocols. Everything is fine. Just your sense of things. Was that an event that should happen, or politically they couldn't get out of it, and maybe it's about money and contracts and things tied up in it?
I'm not qualified to talk about the health aspects of it. I think in terms of the politics, again, when you have certain inertia already, when you've had sort of the celebration that was maybe premature of our vaccination and the fact that COVID-19 rates have gone down, though Delta has reversed many of that, I think it's hard to then cancel it outright. It is an outdoor event, so that does give some cover in terms of rather than being inside. But, I think it would have been hard to cancel outright at this stage. They're doing what they can to manage the situation. But I think, unfortunately, the changing CDC guidelines and the messaging from the federal government on COVID has put a lot of local and state leaders in a bind in terms of how they roll things back.
Let me just take our final moments here and ask you, let's look at the governor's race for a moment. Governor Pritzker seems to be a little more resistant to using things like lockdowns and those kinds of words because we're in election mode already. The Republican challengers for him so far, as we see, basically are, don't wear masks, and they don't seem to be terribly pro-vaccine, that kind of thing. How will that play out in the politics going forward of the Republicans versus the incumbent governor?
I think there has been even though a few Republican media and political leaders have come out as to be more pro-vaccination to recognize the threat that Delta provides, the core base of the Republican Party and the Republican candidates will use messaging to mobilize them. Where I think you worry about the swing voter is how far back we go. A lot of swing voters do not want to mask up again. A lot of swing voters want to see schools open. And so that is where the dance that local and state level officials up for election are going to have to go is how gently do they push to any types of mitigation efforts in the face of Delta.
Yeah, we're going to keep watching that with you. Thanks for your insight, a little preview on what we might be getting there. Eric Nesbitt, the professor of policy analysis and communication, director of the Center for Communication and Public Policy in the School of Communication at Northwestern University. Great title. Thanks for being with me this morning. Have a great Sunday.
Thank you very much.
All right, coming up next on WGN TV Political Report.
There was an attack carried out on January 6th, and a hitman sent them.
Lawmakers look for answers about the January 6th insurrection. Can emotional testimony push the investigation forward? More on that when we come back.